Our next speaker is Dr. César Briceño, who is an assistant professor of ophthalmology at the University of Pennsylvania. He is an oculoplastics specialist, and he will be speaking to us on speaking with and caring for transgender patients. Dr. Briceño.
Thank you, Dr. Quiroz. Thank you so much for this invitation. And I'd like to say that a lot of my experience with transgender patient populations actually comes from my medical school experience. When I was at Johns Hopkins, I volunteered at the Gay and Lesbian Community Center of Baltimore, where I did HIV testing, and that's probably where I got most of my learning in regards to this very complex and evolving topic. And so I'd like to share with you a lot of themes that have already actually been covered by the prior speakers. And really the crux of the matter is that cultural humility and the ability to listen are probably the two things that you need in order to navigate any difficult patient encounter with someone who's different than yourself. And so I have no financial relationships to disclose. We're going to review some key terms and concepts. We're not going to belabor them because the lexicon is continuously changing and quite complicated. We're going to talk a little bit about some of the healthcare disparities that this specific patient population faces, because that's very relevant to how we deliver care. And we're also going to share a few resources and strategies for how to train yourself to be better at this, because it is very trainable, and you'd be surprised how quickly your own comfort level can improve if you take a few of those steps. So some of the things that you'll see out in social media and in the news and whatever are words like these: someone who's transgender, who's a gender minority, or who identifies as gender queer. The term transsexual is still a medical term that you're going to run into in the literature quite often. Also gender dysphoria as far as descriptions of the condition. And people who are cisgender, who are in fact not trans, but the opposite, whose phenotypic and genotypic and mental gender all coincide with one another. You know these words, you're familiar with them because most of you have trained in medicine. The point is not to go through their definitions, but rather to understand that they actually do mean something a little different to each person that you're going to encounter. And whereas to us, it may be a way to codify and understand from a medical standpoint where our patient is coming from, for them it's really an identity. And I think that that's where we need to be respectful of that. And so oftentimes when there is doubt, or when you perceive someone visually and you want to try to understand where they are in the spectrum, resist that temptation. It's better to ask, and to ask in a humble way, and then actually respect what the patient has told you. It takes all of 10 seconds, and it makes all the difference in terms of that patient being willing to trust you, and then you being able to deliver proper care. So, oh, that was just some more stuff there. Words that are offensive. And so, it may seem a little bit obvious to put these here, but these are words that our patients deal with all the time, not only in healthcare settings, but at the DMV, and at the post office, and at the grocery store, and everywhere that they go. And so this is a population that is constantly under assault, both socially and oftentimes physically. They are more often victims of violent crime and murder, and a lot of that starts with words. And so words like these are things that not only you as a provider need to avoid, but that you need to make sure that your staff, the people who answer the phones, the people who are at the front desk, know to be sensitive and know some trigger words to avoid. These matter. Just like the racial epithets that we know to avoid, these are also things that we have to learn to avoid, because it matters in terms of how we are perceived as professionals. It is okay to be curious, and in fact, it's necessary. You need to ask your patient how they want to be communicated with and how they want to be treated in terms of how you record things in a medical record and how you represent them. However, there are certain ways of questioning that are more helpful than others. And so the tendency, at least in popular culture in recent decades, has been to somehow exoticize people who are trans. And so questions like these can be very provocative and not in the ways that you intend. And so again, a lot of these things come from a good place. You want to understand whether the person has had surgery before. You want to understand whether they're taking hormonal treatments. You want to understand their own perception of their own gender fluidity, if it's applicable, but you have to do that in a way that is humble and that is not judgmental. And so questions like these are off limits. We said that we'd talk a little bit about disparities, and so let's go over that just a bit. Transgender patients are indeed underserved in many respects. There are some unique challenges that come along with transitioning or being gender non-conforming. Many of these patients are uninsured, and a lot of these patients have reported in a national survey that they had to, in fact, teach their medical providers about transgender care. So this is a unique situation. You know, a lot of other patient populations never experience this, but this is a patient population where you may go to a provider who's presumably the expert, who actually doesn't understand your medical condition well enough to be able to put it in the context of their specialty. And this is something we should generally avoid if we can help it, and it's not difficult to do. Family rejection is very prevalent. More than half have been kicked out of their home or no longer communicate with their family. Verbal harassment, or just harassment when presenting an identification where the phenotype doesn't match what the person's seeing in front, for example, at TSA, at the airport. Poverty is a serious issue because employment comes along with all these other types of stigma, and a lot of transgender patients are underemployed or unemployed. More specific to our world, the negative health experiences that these patients report are not insignificant. 1/5 have been refused care because of their transgender or nonconforming status. 30% who have postponed care because of fear of actually going to a healthcare encounter. And also a roughly equal number of people who have delayed preventive health care or tried not to get preventive health care, especially when it regards, for example, breast cancer screening, prostate screening, et cetera, because of the sensitive issues that come along with phenotypic and gender. And so that is a challenge. It may not be immediately relevant to what we do as eye physicians, but it is important in the overall healthcare context. So what can we do? I mean, how can we be better? You know, really the primary thing is to be non-judgmental, to be open and to be professional. You know, you want to really provide your care in a client-centered way. You have to meet them where they are. They may have had negative experiences and come to your office with a guard. They may not want to talk about their gender status or their or nonconformity with you, but it may be relevant to what you need to do for them. And so you have to bring it up in a way that allows space for them to speak at their own pace. And this may take several visits to build that level of trust, and you have to be patient. You have to be an ally. So educating ourselves by attending meetings like this is important so that you are trans-friendly in your environment. You know the questions to ask and the ones not to ask, and you know how to open the door to have that type of conversation. The other thing is you have to be an ally in regards to seeing mistreatment of patients and saying something about it. Not necessarily in a punitive way, but in a way to educate our peers. You know, not all of us are always perfect. In fact, none of us are. And so we all will trip up and make mistakes, and we have to rise together. As far as things that we can do and enact in our own EMRs, we can change our patient intake forms to have open-ended questions about what pronouns people want and how they define their own gender, what's their preferred name versus their legal name. These are things that allow people space in which to express themselves instead of boxing them into an area where they don't feel comfortable. Flags in the EMR to point out which patients identify as trans, and things that you can ask. You don't have to ask it in a way. Some patients may feel uncomfortable if you ask this, especially if they happen not to identify as transgender. So you can preface your question by saying, this is something we ask of everyone. You normalize it. You make it part of your standard questionnaire so that no one feels that they're being singled out or judged based on their appearance, which might not necessarily match what you had expected. Creating a trans-friendly environment is different in each healthcare setting. In some places, it's particularly important to have gender-neutral bathrooms to actually represent trans people in materials. This may not be as easy to do with ophthalmic materials, but that's okay. Having a single occupancy restroom in a waiting room is actually enough sometimes just to avoid the discomfort of having to someone go and potentially be challenged about entering a certain door. There are publications that are known to be gay-friendly and trans-friendly, and to have those in the pile of magazines that you have in your office actually already opens the door for someone to feel more comfortable. There are small things that you can do to make a big difference. So I'll finish up with some really, really specific customer service things that we can do to help people out, and you really want to avoid gender-specific markers in terms of how you greet people. You don't have to greet someone by their gender. You can just say, how can I help you? Oh, I'm sorry. I've had an animation here, but it's not. May I just exit here for a second? Yeah. Okay. I'm just going to get rid of that. So I'm going to get rid of these. I'm so sorry. The animation seems to be not working for some reason.
Just go back into slideshow.
Yeah, I will. There we go. So sorry about the busy slide. I was going to go through them one by one, but you really have to find a way to politely ask the uncomfortable questions, especially about pronouns. And so it's okay to ask these things. And in fact, patients will be glad that you did. But you don't want to alienate someone, and you don't want to seem uncomfortable when you ask that question. So practicing a statement like is listed here, I'd like to be respectful, how would you like to be addressed? I mean, that's a very reasonable thing to do. Names are the same. Legal name, preferred names are different. Everyone knows about nicknames. This becomes especially important in someone who's transitioning, because they may not want to be called by their legal name, and that could create a barrier for you to be able to get them to trust you. And so asking those questions is important. We're going to goof up. It's going to happen. You're going to misgender someone. You're going to use the wrong pronoun. It's gonna happen as you learn to deal with this issue. And you simply just apologize and move on. I'm sorry that I used the wrong pronoun. You know, I didn't mean to be disrespectful. How can I help you? You know, and that diffuses the situation. Gender neutral language, the Oxford Dictionary actually now recognizes they as a singular pronoun. Some of us are grammatically very pure and feel uncomfortable with this, but in general, try to be as gender neutral as you can. And the other thing is to really only limit your questions to what is pertinent to the visit. So if they're there because they have a metallic foreign body on their cornea, you don't necessarily need to ask about whether they have had gender transition surgery yet. So there are guidelines all over the place. One of my favorites is the Fenway Center in Boston. They have amazing videos as well as presentations, including videos of good versus bad interactions in offices. They tend to center on primary care, but it's certainly applicable to what we do and very useful. And I want to conclude with this statement from the WHO, which is that the highest attainable standard of health is a right for each and every one of us, and we each have to play our part in making sure that that's the case for all of our patients, even the most marginalized. Thank you.